Hi, this is Dr. Pete again, and I wanted to give you an update to what the information is we know about the SARS-2 or the corona virus that causes the disease COVID-19. Now, we know that the protein on the SARS virus will take up receptor sites in the lung and the gut, but also we're finding it affects the red blood cells. That protein actually cuts away the hemoglobin and iron from the red blood cells so it can't hold oxygen, which helps to create that hypoxic condition as well, besides the inflammation between the capillaries and the alveoli. Now, when the hemoglobin and iron are spliced away, we get an increase of ferritin or iron in the bloodstream, which is creating free radical damage. And that's what damages the lungs to give us that ground glass effect on the CT scans. So that condition then creates a situation where you get a secondary bacterial infection, which is what's causing the pneumonia. So that Dr. Vladimir Zelenko, he was the doctor that I guess the president and some other countries have called because he was getting a lot of success with using hydrochloroquine with erythromycin and zinc. Now, zinc is a mineral that's positively charged, and once it's in the cell, it will throw a monkey wrench at the RNA so that the virus can't replicate. Well, the zinc sometimes when supplementing doesn't get into the cell very well, so the hydrochloroquine acts as an ionophore, which helps to open up a channel to drive the zinc into the cell. Now, the addition into erythromycin helps to deal with that, the bacterial pneumonia that's secondary. Some other treatments, and pay attention to that treatment. It's not a cure. Cure implies it will never come back. Just like the common cold comes back, the flu comes back, chickenpox come back. We're going to see a lot of these things come back over and over and over again because guess what? They're a part of us now. So, the different treatments, you don't ever want to have to be put on a ventilator. There's a 14% of survival rate once you get put on a ventilator. And that was according to the doctor from the University of Chicago. What was more interesting locally is in Southfield at Ascension Hospital, once known as Providence, they had a leukemia patient that did some chemotherapy. No immune system left, right? He gets tested positive for COVID-19. They did a blood transfusion. He felt better in a few days. He got to go home. Crazy. But that lends to more evidence of how the red blood cell is a big part of the involvement of this. Now, we talked about in a couple other videos that the head of infectious disease control from South Korea said some patients are released from the hospital testing negative, and then they get symptoms 2 weeks later and tested positive again. So just because you feel better after you've had some medical intervention, you're not done. Now, there's some other medical doctors, Dr. Butar, who we've probably seen on some YouTube videos. Dr. Circus is a natural allopathic oncologist. And then Dr. Brownstein, he's a local medical doctor. And they use some natural approaches. Dr. Brownstein recommends supplementing with vitamin A, C, and D, and iodine every day. If you are in a more dire strait, he will do some intravenous vitamin C, ozone therapy, or nebulization with hydrogen peroxide. And I've seen some videos from China that had done the nebulization of hydrogen peroxide, and they were saying, or at least the subtitles were saying, that it was like they were set free from like this boot standing on their chest. And then there's a Dr. American Veron from East Virginia and Houston, they used an IV of vitamin C, vitamin B1, and hydrocortisone and they've been getting great results with that. So here in Michigan, still the statistics are 0.003% of the population gets it. And of that small portion of the population, 98% is going to get over it without any medical intervention. The people that have the biggest trouble with this are the ones with comorbidities, including COPD, asthma, heart disease, cancer, diabetes. The biggest comorbidity that we have is nutrient deficiencies. This is what lowers our immune system, or our resistance and resilience. So we need to address this. My next video, we're going to talk about the microbiome and how it has a direct effect on all parts of the immune system. And so you can take steps to increase your resistance and resilience, because that's your responsibility. I'll see you next time.